Good morning. Another day of stay at home during the COVID-19 crisis. I am a medical physician, and a friend of mine sent me an article the other day that was a Real Clear Politics article that was authored by William Bennett and another radio talk show person that described we are overreacting to this, and this is probably going to have a flu death rate or a death rate less than the flu of possibly 1/10 or 1/8 that of the flu from the COVID-19, and that we shouldn't be as worried as we are and shutting down the economy with stay-at-home orders. I will post some interesting articles that I've gone ahead and read that discuss differences between seasonal flu death rates and hospitalizations and the death rates associated with the COVID-19. That was a comparison performed in China during the Wuhan spread of the disease. But I wanted to go ahead and review what some of their assumptions are. Their assumptions don't have any real true facts or statistics to back them up, other than assumptions that people are saying or people have made about the disease process. When we look at flu mortality rates in general, spotty reporting at the beginning of the century, but from 1900 to current rates, the flu mortality rate was roughly about 2 to 4 per 1,000 until the advent of vaccines. And now with the advent of vaccines, it's usually less than 1%. Less than 0.01%, and oftentimes 0.05% since the vaccines began in 1930s. If we look at the Spanish flu pandemic, which is probably a reasonable comparison to the current COVID-19 crisis, you are looking at a mortality rate of roughly 3.1% for the population from that infection that was infected. So the overall, but that was actually an overall death rate because they didn't really break it down as much. They just looked at excess deaths over average, and that would come out to about 3.1%. So we can look at it having a significant impact on the population if it's basically not contained. The recommendation in the article is to take people of immune compromised status or over the age of 65 and go ahead and place them in isolation or quarantine or whatever you want to call it. But I reviewed census statistics and statistics from 2016, but best census data I have is 2010 census. And the 2010 census basically stated that while there are between 60 and 70% of the adult population over 65 either living with a spouse or possibly in nursing homes, there's roughly 30% of the population that lives with other family members. And we can presume from that standpoint that it's probably younger family members taking care of elderly parents. So the problem is trying to isolate that group of people from the younger people who are going about their daily business of going to work, etc. The likelihood is that the vast majority of those would probably be infected. If we look at the COVID death rate by age, I can look at some different comparisons. One of these is Italy, with 72% of the people who died being over the age of 55, and 26% of the people died being 19 to 50. I don't exactly know what strain of COVID virus they have, but apparently there are 8 separate strains running around the world. And I think the United States has 2 distinct strains that are present. I don't know where they're distributed. But in the United States, the 45 to 54-year-old death rate right now stands at 0.05% as of March 20th. 55 to 64 age group 1.4%, and 65 to 90 age group averaging about 6%. It's 10.4% for those over 85 and 4% for those between 65 and 70. So I'm just trying to average them out since we're discussing putting people at home over the age of 65. Now those death rates are as of March 20th, and as you look at the current death toll in the United States, it has bumped up to almost 3% total of the positive cases that are currently available out there. So the rationale that this is going to be reduced substantially as time goes on isn't actually playing out almost in every case in every country where epidemics have come and gone, or this COVID-19 has come and gone. The statistics of death are very similar to what they're reported as of cases and actual death percentages. So I don't think that that's actually going to work out as a reduction in death over time significantly. If we presume that we're going to isolate the people 65 and older, again, the individuals living alone or with their spouse, possibly able to do that to some degree, but they're going to have to get food or whatnot from other people in order to survive during the period of isolation or quarantine or whatever you want to call it. And that will result in exposure to cardboard boxes, etc. And I'll discuss this later in a video, that the persistence on cardboard can be as long as 2 days. Persistence on hard surfaces can be as long as 3 days. So it's not exactly an easy thing to go ahead and say, well, we're going to just isolate these people and they'll have no contact with younger people. They're likely going to have contact with infected items dropped off by younger people in order to keep them alive. The other part of that is that the younger people in the households of the 30% of the population that do go out to work and bring home the infection to their older relatives that actually live in the house runs the risk of infecting the majority of those people with the COVID-19. And if we look at half of those people being infected, you're looking at 30 million people, so 15 million people infected with a average of 4% death rate. You're looking at 1.2 million people dying. So it's not an insignificant number, and only if everything works exactly as you plan it, the death rate is likely to be still about 1 million people, which seems to be rather extreme. People talk about damage to the U.S. economy in the economic recovery bill of $2.2 trillion or $3 trillion, and it brings together the entire spectrum of, well, let's decide who lives and who dies. If you're over 65, I mean, I guess you've outlived your usefulness, and we should just let you die, or reduce your risk of living by not doing something we could have done to prevent it. I don't know what the right answer is, but it seems to be a rather callous methodology of looking at the older population. In any event, I've gone ahead and I've put several links down below that will cover statistics of age distribution of 65 and older, as well as an interesting graph comparing the flu complication and death rate in China with the COVID-19, and also an article as to why COVID-19 is worse than the flu. And hopefully that will give people some interesting perspective on why dramatic steps are probably necessary in this particular pandemic. Also, in reviewing data, even with the potential infection rates that are likely to occur with the isolation of people, the hospitalizations are still going to be significant, because even though you don't have a significant death rate associated with the under the age of 55 population, there is still a substantial number of them that do end up getting hospitalized, and the medical cost of the hospitalizations is fairly extreme, even though they might survive. So again, curbing the virus spread nationwide is important for helping to preserve the functioning of the healthcare system. You can certainly ask the medical health professionals in New York City hospitals whether or not they think this is just a standard flu, and I'm sure they will tell you this is not the flu. And if we look at potential costs of taking care of people for 2 weeks in the hospital, you're talking a significant amount of money if the if the COVID-19 disease is allowed to run rampant. And as a result of that, I would say that certainly let's try to work together as a nation to get this under control, and then deal with pockets of disease that happen to come out as they appear, with more aggressive isolation and contact tracing at that point in time. And then that way we can be finished with this in a much faster fashion. Thank you.